Hi, it's Dr. Gemma, and today's topic is breathing. And before I get started, I want to thank my supporters on Coffee, who, you just check in if you like what I'm doing, you support the project. I really appreciate it. It's just little bits of money. It's not like big stuff. I think it's $3 is what they consider a typical donation. But it's ko-fi.com/DRGEMMA. And thanks. Anybody does that, I appreciate it. It buys me a little time to do stuff like this. Okay, so the topic, oh, and by the way, thank you. My latest coffee donor is our own Peachy, Jin Sr. Thank you very much. I really appreciate the support and the loyalty. So scratch my nose, fix my glasses, and talk about breathing. Why am I talking about breathing? Because it's probably the single thing I'm going to say to you as a psychotherapist that will annoy you the most, but is the most key to your feeling better. Now, this comes out of a very simple logic, all right? When your body hurts, it's really hard to feel good mentally. All right? That's pretty obvious, isn't it? That if you're in pain and I tell you to calm down and be happy, that's going to be a lot more challenging than when you're not in pain. So when we do any kind of productive therapy, we're going to start with the body first, get the body into some good shape, as much as we can realistically. If you say, oh, I had one patient come in and say, I put on all this weight and I hate it, I can't say, well, we've got an hour to lose weight. So there's things we can't do in the office if a patient asks for it. But the simple control of the body we can do, and that's going to lead to a lot of other improvements in the body. So one of the foundational thoughts when you're doing cognitive behavioral therapy is start with the body, all right? And the breath is probably the easiest way to start. Because you come into my office, and a lot of patients come in like this, because they've driven through traffic to get here. They've been thinking about the bad things in their week to figure out what they want to talk to me about. So they arrive revved up, all right? The problem with this is what's going on is they can't actually think well because they're revved up. Now, being revved up, whether you're depressed, whether you're anxious, whether you have racing thoughts, often, mostly starts with too much carbon dioxide in the body and too little oxygen. So you can see why we're going to ask you to breathe. But there's a lot more to it, and it's important stuff, and it goes into this. And so next time a therapist asks you to breathe, I want you to be aware of what they're doing, all right? So what's going on here is you've got too much carbon dioxide and too little oxygen. And what that does is it disconnects the part of your brain that can actually talk to me in therapy, which is kind of crucial. In other words, you come in my door unable to actually talk, and yet that's what you're here to do, all right? And what I'm talking about here is the frontal and prefrontal lobes of the brain. They make up a relatively small part of your brain. Now remember, your brain starts here and goes all the way down to your tailbone because your spine counts, all right? But your language that you can use to talk to me lives right up in the front here. Okay, you have from about here to here, you have, and just a little bit back, you have the frontal lobes, and then you have the prefrontal lobes here. The frontal lobes let you think in your native tongue, in my case, English. And the prefrontal lobes let you think about what this is thinking. So for example, right now you're saying, okay, she's talking about the brain, and this part's going, is this going to relate to breathing or isn't it? All right, so that's the frontal lobes, prefrontal lobes. This is why you're not your dog. Your dog has very little of this. This is why we talk about animals being conscious or not so conscious, because this is where your awareness of yourself as an independent and autonomous being lives. Okay, so the more of it you have, the more you're likely to be able to think about that stuff. Now, the important thing is when you're in an emergency situation, you basically stop breathing for a good reason. Your body actually wants you to flood with carbon dioxide. And that will make your muscles able to act more quickly to get you out of danger. So that's a good thing. Okay, and the reason that even works is most of your brain doesn't involve human language. This part all the way back, this part back here, this uses symbols, and all the way down here, you're using biochemistry and biochemical messages, all right? So what I'm saying is when you're in danger, this part will slow you down because it takes too much time to think and to make words. Oh heavens, there's a fire, perhaps I should run. That was 2 seconds. This part moves at the speed of light. It doesn't need words, which take time to formulate. So this part's moving at the speed of light, which is what, 586,000 miles per second? You can tell this part is infinitely faster than this part. So in a crisis, our brains cut this part off because it's not helping us to get away from the danger. Well, that's nice, and that was applicable 30,000 years ago. Here in the 21st century, what is your danger? Is it your angry boss? Well, you're not going to get up and run out of the room. You'll get fired. So strangely, here in the 21st century, danger is a very different thing for us. That even though our body is geared to run away and to do all this beautiful high-speed work, we have to keep thinking when our boss is accusing us of doing something wrong. And our body is not helping because it's cutting off our rational thought and just telling us to run like a deer, all right? That's what the deep breathing is for. We got to reconnect this part of the body. To do that, you've got to drive down your carbon dioxide, which means you got to take in oxygen. That's all there is to it. All right, so we owe a lot to Hindu culture for this. They taught us basically the basics of breathing. They figured it out the hard way just by trying thousands of years ago. So many thanks to them, because this is not something that developed in the Western world, let me tell you. All right, so how do we breathe to get enough oxygen, to calm down, to reconnect our language centers so that we can talk in therapy, or we can think when the boss is accusing us of something, that we should respond to? There's two basic ways to breathe. The first is diaphragmatic breathing. The second is what we call army breath. We use them in different situations. All around emergency breathing is the diaphragmatic breathing, and it works very simply. All right. When you're anxious, because you're driving up your carbon dioxide, you're going to pant. Okay, like a dog. Well, that works for a dog. They don't have a lot of prefrontal lobe, and they're also trying to sweat. Okay, it doesn't work for us because we're not getting enough air to activate our brain, okay, our forebrain. So what we're going to do is we're going to work on getting enough air. So this is how we teach people to do it. Tip a little finger on your belly button, hand on your abdomen, and you're going to try and move the muscle, the diaphragm, that lives at the bottom of your rib cage. You want that to do this. That will pull your lungs open, and they will wildly fill with air, okay? So you're going to do this. Now, hands should move. Now, it's easy to see on me because, I'm an older woman, so I'm more developed here in the chest area. So you can see my whole chest rise and fall. But remember, in a child who's flatter in this area, it's harder to see when they're doing this. That's what the hand is for. So you should see the hand move in a diaphragmatic breath. If you're the person doing the breath, okay, earthquake. That was interesting. If you're the person doing the breath, you should, I live in Southern California. Did you notice that didn't faze me much? Okay, if you're the person taking the breath, you'll feel your hand move on your belly. Okay, so it looks like this, which is a good thing to do when you've just had an earthquake run through your frame. All right, that's the diaphragmatic breath. And what we're doing, we're pulling the diaphragm down. When the diaphragm is pulled down, the lungs are pulled open wide and they flood with air. Your lungs, of course, on the inside are bigger than they are on the outside. Doctor Who fans take note, because they have all this curling tissue inside, and so it's got lots of surface area for the oxygen to get right into the bloodstream directly from that surface area. Isn't that wonderful? So that's diaphragmatic breathing. So when you are in crisis, when you're having problems, the Underdog theme song, when you find yourself in danger, when you're threatened by a stranger. Actually, that's the Super Chicken theme song. But anyway, when you feel like you might take a licking, okay, when you're in danger, you take a big deep breath and you flood your lungs with oxygen. Okay, that's the fast and easy one. But what about at night? You can't sleep. That's where we teach people army breathing. Army breathing is used by the Army for guys in war zones, because how do you sleep in a war zone? And yet if you don't get enough sleep, you're going to be in more danger. And I'm sorry, I have a cat creeping in here that I may have to address. All right, so when you're in danger, you have to sleep and yet you can't. That's the paradox. So in the Army, they teach army breathing. What I want you to remember for army breathing, 4, 5, 8. If you have a piece of paper, jot it down or replay this. 4, 5, 8. Okay, and it works like this. Inhale on a beat of 4. Hold your breath for 5, for a count of 5. Exhale on a beat of 8. Now what you'll notice right away there is you're exhaling twice as long as you're inhaling. That is critical, and you must do it that way. So what that means is your inhale is going to be like, which is basically a diaphragmatic breath. Big, fast inhale with your mouth wide open. You're going to hold it. You're going to inhale for 4. You're going to hold it for 5. You're going to exhale, pushing through your lips for 8. Okay? The important thing there, when you inhale, you activate your sympathetic nervous system, which wakes you up and makes you ready for action. When you exhale, you activate your parasympathetic nervous system, which calms you down and allows you to sleep. So you can see why we want the exhale to be twice as long as the inhale. Okay, so this is what it looks like. I'm going to try and count with my fingers. Have a little pity, it's hard. If you see editing here, you'll know why. Okay, so I'm going to try and count with my fingers as I do it. Okay, that's what an army breath looks like. You can tell I had to close my eyes because I really have to focus on that. Okay, that's what army breathing looks like. Rumor has it, if you do that for 10 minutes, you go to sleep. I don't know, I've never made it past 3 breaths, which didn't take me 10 minutes. But we really want you to do that because we really want you, as weird as it feels, we want you to get used to the big inhale. So you're getting a lot of oxygen, but the long exhale so that you're activating the nervous system that lets you sleep, the parasympathetic, okay? And when you think about it, it's really brilliant because this is what we do all day as we breathe. We inhale, activating ourselves, waking ourselves up. We exhale, calming ourselves down. And so you're going to find when you practice this, you may have trouble on the exhale because when you're awake all day and trying to be awake, you're probably breathing in longer than you're breathing out. And if you've ever done yoga, they emphasize breathing out more slowly because in yoga, you're trying to calm yourself down and focus, all right? So there we have it, the 2 forms of breathing. And please try to remember that if you're excited and someone you trust says, take a deep breath, you should probably take about 3. I usually tell people, give me about 3 good deep breaths. When we do hypnosis, we use usually 3 to 5 deep breaths, cleansing breaths, whatever. And we're doing that to get the person in a state where their parasympathetic is active and they're more ready to relax. So I'll see a lot of times in therapy, I'll say, take a deep breath. The person goes, okay, you happy? And then I'll just say, yeah, I am happy. That was good. You just praise it. Do it again. Because it's really hard for someone when they're activated that way, when they're anxious or sad or angry or worked up. It's very hard to do the deep breath. So you want to work on getting them to take 2 or 3 because eventually their body is going to slow down for them. So that's what you need to remember. Number 1, the diaphragmatic breath. 3 big breaths, hand like this, little finger on the tummy. You can see my upper finger is just a little bit up my breastbone here. 3 big deep breaths, hands should move. When in any kind of crisis and you need to focus, that's what you do. And if you need longer term calming down or to go to sleep at night, you use the army breath. Army breath, 4, 5, 8 is the count. Inhale 4, yeah, inhale 4, hold for 5, exhale 8, pushing out with your lips. Okay, there we go. That's breathing for you. Once again, thanks to my sponsors on coffee, everybody else, everybody. Really, I appreciate your listening in. Everybody stay safe, take care of each other, and I'll talk to you soon. Bye-bye.